Hello, City staff. I'm Paul Casey, City Administrator. Around this time every year, I go around to the departments and provide employee briefings to you all. What's going on in the city? What's new? What are we working on? Answer your questions, and it also gives me a chance to say hi to a lot of you. Unfortunately, this is not a normal year, and so I'm unable to go out and do those briefings with you. So instead, I've decided to do this video briefing to talk to you about COVID-19 and the city's response, and I hope to do them weekly at this point to get key information out to you and also answer your questions. So in the future, you will see us send information out about how you can get questions into me so that I can answer them as part of these broadcasts as well. First off, thank you for your service. As city employees during a crisis, we become emergency workers, and this is a crisis, and the community needs us. And I appreciate everything that all of you are doing to continue important city services during this crisis for the community. I appreciate all you do, and you also make me proud to work for the city of Santa Barbara. Also, take care of yourself and your family members. We care about you as individuals, we care about your family and your loved ones. So it's important that we do the best to try to stay healthy through this crisis. I really appreciate everyone working to keeping the city up and running during this time. We provide a lot of services as the city of Santa Barbara. For instance, we'd have police, fire, and harbor patrol out there on a daily basis on the front lines, interacting with the public, providing important and critical public safety. Thank you for all you do. We also have water and wastewater employees, also providing critical infrastructure needs for the community, both at our water and wastewater treatment plants and also out in the field, making sure our infrastructure is in place for that public health necessity. We've got streets crews and parks crews and library staff out there working daily. Thank you for all that you're doing. Other public works staff like engineering, streetlight maintenance, downtown parking, and others. Thank you. We've got community development staff who are trying to figure out how to keep the land development team process going, how to run boards and commissions during this crisis. Thank you for everything you're doing in that regard. Thanks to our administrative staff. For instance, thank you to the finance staff for making sure we still get paid on a bi-weekly basis, showing up and getting that critical function done to support all of us in what we're doing on a daily basis. Also, thank you to the finance staff for managing our finances and understanding the fiscal impacts to us. Thank you to the airport staff managing through a devastating crisis when it comes to airline travel and trying to manage the airport operations through all that. And thank you to the staff in my office, working tirelessly, supporting me, supporting the City Council. Thank you for all you do. I could go on and on. I really am so proud of everyone who works in the city organization. So if I didn't mention you specifically, know that I equally appreciate everything you're doing for the city as well. The mark of a good organization is how it responds in a crisis, and I trust that we will respond greatly as we always have in the past. So thank you. So here's some key updates and information about what's going on that I want to share with you today. We continue to manage the public health crisis that we're facing, and it really comes down to very straightforward basic messaging. Social distancing works. Stay 6 feet away from people when you're out in the public. Stay home as much as you can when you're not at work. Encourage your loved ones to stay home as well. Wash your hands with soap and water frequently. Can't stress that enough. Those are the best practices and best messages that we continue to promote and that the public health professionals are encouraging all of us to practice. Some recent steps we've taken to continue to emphasize that in the community. We have messaged much more strongly that we are not encouraging group activities in our parks and outside. Only non-group activities in the parks. We've closed the boat launch ramp to help promote social distancing, and we continue to do signage and everything we can out in the community for that. Public health professionals continue to stress that it is okay to get activity outside. In fact, they encourage it, both from a personal health standpoint and the benefits that exercise can bring, but only to do it if you can do it safely and within a social distancing standpoint. If you go to a beach or you go to a trailhead and it looks crowded, don't go. Keep driving. We can do this, we can use common sense, and we can do the best at getting that exercise while doing it safely and appropriately. Just over the weekend, the guidelines and recommendations changed with regards to wearing masks for non-emergency personnel. As you know, those N95 masks are critical for our healthcare professionals working in the hospitals and also for our first responders like police and fire. However, the guidance changed that officials are now encouraging us to wear cloth masks, even homemade cloth masks, when you're out in public, especially at grocery stores, at pharmacies, or when you're going to be in a situation where you may not be able to practice that safe social distancing. This is an example of one of the cloth masks that the great Julie Ruggieri made. My daughter made me one over the weekend as well, so get your children at work helping you out on that. I'm not sure if I'm going to let my daughter cut my hair at some point, but we'll evaluate that as we go forward through this time. Remember though, the masks help, but they should not give you a false sense of security. It is still crucially important to practice that social distancing, wash your hands, and stay home as best you can. The masks are just an added protective to the virus, but should not be considered a safeguard that can let your guard down with respect to the other measures that we still continue everyone to take. As you know, as a city organization, we're a large employer. And like every large employer, this crisis has hit us hard from a financial standpoint. We've had to shut down a lot of our operations and had to shut them down quickly. Our parking lot kiosk operations, our after-school recreation programs, our upcoming summer recreation program schedules is just an example. That's why recently we had to make the tough decision to give official notice to many of our hourly employees that we just don't have work for them. We weren't giving them hours since the items that they were working on had been shut down. By giving them official notice, it did allow them to qualify for unemployment benefits. And so we did do that. I didn't take that decision lightly. Employees are the mainstay of our organization. We are essentially a service organization, so the employees are everything to us. And so that was a difficult decision to make that for our hourly employees. Our hope is that we get past this crisis, we stabilize and we bring those programs back, and we will reach out and hope those hourly employees will come back and continue to provide those services going forward. The budget impacts remain a big concern of mine about this. Our revenues have been hit dramatically. Bed tax is one of our 3 biggest revenue sources, and it has been decimated by this closure. Sales tax, the same way, has been hit hard. A lot of our departmental revenues have been hit very hard. We continue to evaluate that closely as data comes in, and we will need to address that at some point. I don't have information for you today on that, but in future updates I will talk more carefully about the budget. I do promise you that I will be open and transparent about our budget situation, and we will work together to get ourselves through this financial crisis as well. On the employee front, we have added 80 hours of COVID-19 leave to everyone's bank, and that is to supplement our sick leave and our vacation time off, such that you have the ability when you need it to take that time off. HR, Human Resources, has sent out guidelines about the use of that leave, and I encourage you to look on our intranet SharePoint website that has information about the use of that leave. But that is a gesture on behalf of the city about how important your health is, and encourage you that at any first sign of not feeling well, we want you to go home and self-isolate, both for yourself but also for your coworkers' safety. Finally, we receive updates from the county every day on the number of cases countywide. All that information can be found on the county's website, and if you're interested in those updates, I encourage you to go on that website. It's publichealthsbc.org. Has very good information on a lot of stuff related to the crisis. And we also have the city's website that you can go to, and we've got a lot of information as well. April is a critical month. All the public health professionals are pointing to this month as being a very challenging month for our country and for the world. And so staying up to date and staying well informed with facts is important. Thank you for watching. Like I said, I hope to do this on a weekly basis to keep you informed and to stay connected. We want to find a way to get your questions to me. It's one of the things I enjoy most when I go out and do the employee briefings, is answering your questions directly. So we will find a way to accommodate that in future updates as well. Thank you for all you do. Please stay safe. Thank you.